one.
Hello, this is Dr. Yates, and the title of this video is Dr. Yates FUE versus FUT. Let's start on the easy stuff first. What does FUE stand for? FUE, follicular unit extraction. Great. Okay. What does FUT stand for? Follicular unit transplantation. Okay. So the easy way to remember it is FUE is removing the follicular units individually, one by one from the scalp, where FUT is the strip method. So anytime you see FUT, what does that mean? That means the strip. Every time you see FUE, whether it's from the artist, from the neograft, or by hand, or by manual motorized system, it's the same, okay? FUE versus FUT. Let's talk about FUT first, because this is the common things that my patients say to me when because they know I'm an FUE specialist. I teach a lot of people about FUE. I've been doing FUE a long time. I believe it. I believe it wholeheartedly that it's actually a superior procedure. I've had it done on myself. I've done it on my son. The hair grows great, and there's no scarring, stitches, pain, bleeding, or anything else that you want to associate surgery with. So let's talk about FUT. Why are people still, number one, why are people doing it, or why are people saying it's good? Okay, so FUT, for those who don't know, the area in the back is called the permanent zone of donor hair. So you always evaluate this first. So when you see a new patient, it doesn't matter to me what the supply side looks like. Pure Economics 101, supply versus demand, okay? Supply versus demand. And I probably said the wrong way the other time, but it's supply versus demand. So I'm always looking at what is the supply side. Then I look at the demand side, and then given the supply, then we'll figure out what the demand can get. So here's the argument with FUT that you'll see if you go to a surgeon. They'll say, my patients will say, well, I went to see Dr. So-and-so, who's a great doctor, and he said if you do FUT that you can get more grafts, okay, it'll take less time, and the grafts will grow better if you do FUT, and the scar will be a tiny little scar, and I'm not going to shave my head anyway. So why would I want to, bother with you and do all this fancy FUE and have you come back here and pluck hairs out, move them up here, and so forth and so on, okay? And they also said, hey, my doctor said, doctor, I need 3,000 grafts, I need 2,000 grafts, and you can only do like 800 grafts FUE. I hear this all the time. 800 is the magic number. Somewhere out there in the world, 800 is the FUE number. Okay, let's start. Everything that person has said in my practice is not true. Doesn't mean that it's true everywhere, but it's just not true. Number one, we do sessions daily where we can do 3,000 grafts with FUE using the artist robotic system or myself. Either or, you can come in here at 8 in the morning and be done by 6, 7 at night with roughly between 2,000 or 3,000 grafts. 3,000 a little later, but it's not going to be 10 at night or 9 at night, and you can go home and have it done in one day. Okay, so that's one thing. Number two, the grafts don't grow. The grafts grow fine. You can look at a lot of my profile pictures on the Bald Truth. You can come in, we have a referral list, you can see actual patients. And by the way, that's the best way to see a hair transplant patient, because when you take a photo of a patient, especially when it's not standardized, you can make the hair look as good or as bad as you want to. So any place that you go and you look through photo books, of course, there's going to be the best pictures you can ever get there. But what you want to do, you want to look at a patient. Because why? Everybody's head is different. There are no two heads that are alike. There's no two demands that are alike. So you want to see a real patient and say, hey, Dr. Yates, I've seen this book, but I want to see a real patient's head. I want to see a real patient's hair. That's not a problem. You can see that. But to answer that question, you can do 3,000 grafts FUE, 2,000 grafts FUE in one day. Okay, that's one. Number two, the hair doesn't grow. Now, why would somebody say the hair doesn't grow? You know, the reason is they say, there are lots of reasons. I've heard, one, they'll say the grafts are too skinny. That's one. The other, they'll say, well, they chop the grafts up when they take it out. And that can be true. There's skill. That's why FUE surgeons who are experts at this will charge more, because there is technical skill involved going down, getting the hair, follicular unit, down beneath the dermal papillae, so when you remove it intact. You don't want to transect it. Your transection rate should be comparable to a transection rate when you do a strip, which is what, 3 to 5%. You shouldn't have a 50% transection rate. So a lot of people, when they come and they say, well, I know somebody who does FUE, and I say, great, I'm happy more people are doing FUE because that's the way to go. And then I'll say, well, do you know what their transection rate is? Because just like a golfer, you ask a golfer, what's your handicap? People who can really play golf, they say my handicap's 12, my handicap's 2. People who really do FUE, they speak in numbers that you can compare. Say, what's your transection rate? Then I always say, well, for this type of hair, because it's different. African American hair with just a C, you know, the transection rate's higher. It's around 8 to 10% sometimes, you know, in the cases. On a garden variety case, our transection rate is just like the strip, in the 3 to 5% range, and we keep track of every case that we do. So you want to know, somebody does FUE, you want to say, because all FUE is not the same, just like all strip surgery is not the same. You want to say, hey, what is your transection rate? And then if somebody says, oh, it's blah, blah, and if their eyes go up and to the left, I saw that on Judge Judy, that means you're not telling the truth. So make sure you know what the transection rate is. So this is the answer. If you take out good grafts from here that are viable and are not transected, you put them in the appropriate holding solution, and you put them back in the scalp, guess what? They're going to grow. They're going to grow just like it did when they took a strip out. So that argument is null and void. Also, when they say the grafts are too skinny, that's not true either, because the grafts that we use, and I've said this many times before, when we do eyebrow transplantation, are paper thin. There's no fat anywhere on them. We put them here and they grow like crazy. So that argument's not good either. So the grafts are skinny, they're not transected, we put them here, they grow, grow, grow. And they grow great, and you don't get a scar with stitches. And people say, let's talk about the young guys or the older guys. Say, hey, I don't, like I have my hair short now. They said, Doc, I'll never wear my hair short. Well, I want to tell you something else. If you go on all those forums and listen to what all the guys say, especially the young ones that are angry, the first thing they're going to say is, I had this transplant and I don't like the hair up here for whatever reason, and I got this dumb scar in the back. Or I like my hair up here, but I got this dumb scar in the back. You know, and you can look on a forum right now and there'll be 10 people talking about their scar and how to make it better. You know, they talk about the scar more than the hair up here. So let's take away the variable. Why would you want to get something that you know already has the potential to not look good when most people aren't even thinking about this, because they just think, oh, who cares? I'm thinking about this. But you got to think about both things, because if you got a bad scar back here, you know, and you have hair here, you're not going to be happy. You are not going to be happy. So you want to make it as imperceptible that nothing's going on back here and that you grew hair. So a lot of guys will say, I'm not going to shave my head. I'm going to tell you the truth. You have no idea what you're going to do next week. A lot of guys who are younger, even older, everything in life's about options. You want to cut your hair. I cut my hair long, I cut it short. You don't want to be locked into any style. You want to cut your hair short, long, whatever. You want to have options. So just because you're in some place and somebody's saying the price is, you know, 50 cents a graft, and they're going to take it out, and you're like, oh, that's great, because I'm not going to cut my hair anyway. That's not valid, because you don't know that. And then if you cut your hair, or you do want to cut your hair and you have this scar, then you're angry. And even though you paid a low price, and it might be a great job, you're still angry. So I'm trying to prevent that by doing FUE, giving in this area, no stitches, no scar, no long cut, moving the grafts, moving them up here, and they grow. So what's the downside? Okay, the downside to FUE, I really haven't found much, because we use a small punch, we use a 0.9, you can go down to a 0.8 millimeter punch, which is even smaller. The artist is a 1.0 punch. And I can tell you, using the 1.0 punch in the back, you cannot tell the difference between if somebody used a 0.9 punch or a 1.0 punch or a 1.2. It all kind of looks the same. The trick with FUE is that you have to spread the density. You just can't go right in here and take out all the hair, because yeah, it's going to look thinner. And another thing with FUE, it decreases the density throughout the back by about 20% when I do it. So we usually make 14 to 16 boxes, depending on how many grafts we do. An average case is 2,000 grafts. We spread the wealth equally, because what you want in a good hair transplant is what? Equalization of density. You want the back to be as dense as the top. You don't want, because why the top looks thin is the eye picks up the high density here and the low density here. So you want this to look like this, okay? You can have more FUE procedures. So you have one FUE procedure, we do 2,000 grafts. You can come back and have another one. We can actually take hair, if this doesn't look like you're having retrograde alopecia, you can never get hair down here at the nape of the neck with the strip. They used to do it because they take fine hair, so I can always see who had a hair transplant in the early 90s or 80s. They'll have a cut down here to take the fine hair. Bad idea, because it doesn't heal well. We can punch this hair all day long. You will not notice it. And we use it for the temples, we use it for the hairline, and you can get quite a bit of grafts back here. We've gotten 8,000 grafts, 9,000 grafts from donor and just nape of the neck. Now the book will say the normal donor might yield 6,000 to 7,000 grafts, because you have to leave hair back here so it doesn't look like, oh my God, what happened? You got hit by a truck. It has to look good here and it has to look good here. But I can tell you for a fact, we're able to get more hair with an FUE procedure overall than you could with the strip. Now a lot of people will argue and say, well, that hair you're putting in is not permanent hair, okay? Because maybe you're going in the nape of the neck, maybe you're going higher here. But we pretty much stay in the permanent zone for the most part. If we go way down to the nape of the neck, we make sure that that patient doesn't have a pattern we think of retrograde alopecia. Yeah, we can take it in front of the ear and go here, but we don't do anything reckless. And then number 3 or 2 or whatever number I'm at, we can also take hair from under the beard. We do that, and I've had that done to me, and you will not be able to tell with the 1.0 punch that you've had anything done. We can take 500 grafts from each side. That's another 1,000 grafts. So people come to me all the time, have 5, 6 strip scars in the back of their head. I don't judge, because I have plenty of scars in the back of my head. Tight scalp, and they'll say, Doc, I want more hair. We get more hair back here, we get more hair under here, and it heals up great. So as far as I'm concerned, there's really not a downside to FUE. And a lot of the surgeons, or even the public, that have been convinced that something's wrong with it, I just think they're not informed to know the beauty of this procedure. It's a good procedure. Yes, it takes work to learn how to do it. I mean, there's a learning curve, but it's not magic. Anybody with good eye-hand coordination can do it. I think it's a better procedure, especially for young patients, because a scar is like a tattoo. It's permanent back here. A hair transplant's permanent. So you want to limit the variables. You don't want to have too many things going on. A scar here that you have to worry about the healing, and the growth here. You want to concentrate on the front. So, this is Dr. Yates, FUE versus FUT, and I'm voting for FUE. So if there's any question, you can call me directly. I will try my best to call you back the same day. Everything that I've told you I've had done to myself or somebody in my family. I see patients all day that want to have strips, and you know, young people, I will try my best, and I won't really do a strip on a young person because I've just seen this happen too much. A young person, I mean somebody in their late 20s, 30s, even 40s, because what's the best thing in life is to have options. You don't want to be trapped into anything, you know, so the scar traps you into having long hair, and just because you have long hair today doesn't mean you're going to have long hair in 5 years. Simple enough? I think so. This is Dr. Yates. Thank you.